Good afternoon. I'm Paul Rothwell, and it's a couple of minutes after 1 o'clock, so to stay on schedule, we'll proceed. I'm the leadoff hitter this afternoon. You know, the goal of a leadoff hitter is not to hit a home run, but to hit a single and get on base, so hopefully I can do that this afternoon. If you came, as your schedule states, to see Dr. Clancy, I'm sorry, he had an emergency, could not make it, so they moved me up. So you'll either be disappointed or maybe elated, I don't know. He was going to talk about insights into genetics, and actually we will be speaking about genetics as it pertains to cancer at the cellular level. This morning I was reading John Maxwell, and he said with success comes options, and it's how we use those options that defines our character. And I think that's very true, because when we use our resources as healthcare professionals, if we've been successful on ourselves and self-fulfillment sometimes, it doesn't lead to a very good road. However, when we focus on others and their needs, that I think is the road to happiness. And as physicians and healthcare providers and professionals, we have a unique opportunity that maybe others don't have to help others. And no other area can we help as much as we can help with those who have been given no other options, specifically those who have stage 4 cancer, who have been through chemotherapy, perhaps radiation or both, and have been given just a matter of days and absolutely no hope. What we do, and I think you'll see that today, is give patients a realistic hope. As you can see, I wear many hats. What I really enjoy doing is teaching medical students at the University of Oklahoma. Third-year students come to my office and we study integrative medicine. They're very open to this, by the way, much more open, I think, than some of the other faculty, perhaps. And also I do a lot of bioidentical hormone replacement therapy. Well, what's a wellness doctor that does integrative medicine treating patients for cancer? I guess we don't say treatment, we're giving therapies for cancer, if you want to be strict by the FDA standards. What are we doing? Well, there's a long story, and I can share that with you. I'll be at booth 717 from 4:30 until close, which I think is 6 p.m. this afternoon, so booth 717. And I'd be happy to meet you, answer your questions, because there's not going to be much time for that during this lecture. What is integrative medicine? Very briefly, before we get into the meat and potatoes of this lecture. A cutting-edge combination of traditional Western allopathic medicine and evidence-based or outcome-based alternative, what I like to call innovative therapies, with emphasis focused on preventative or proactive medicine versus sickness care or reactive medicine. You know, in medical school, the first year, those who are medical doctors here, we were taught all about how the human body works, the anatomy, the physiology, all of the way the body works. Then it seemed like the second through the fourth years we focused just on the diagnosis and treatment of disease. And that continued through residency. And nowhere along there did we talk about getting things back in balance to go back to normal physiology. And so I think the focus of Western medicine is basically what I call sickness care. And maybe that's a little hard, but I think that's what we've done. We've given lip service to preventive medicine, but there has been very little done. Thank goodness the A4M and the physicians that are involved and the healthcare professionals with this organization are doing something about that. Well, how does wellness care relate to cancer patients? That's why I put this slide in here. I think it's very important because, you know, there are a lot of oncologists who would say to the patient, you have to accept the reality that you have stage 4 cancer and you're going to die. You know, get prepared, get everything in order, this sort of thing. And really, you know, all the chemotherapy is going to do is palliate you perhaps a little bit longer and probably make you sick. And it's usually at that point that the patients come to us as someone who has something to do that is integrative with the Palladium Lipoic complex and with dietary counseling and supplements, and ask for help and hope. And we do give them realistic hope, and I'll show you some of the statistics on that later. And I think the wellness part of cancer therapy is we have to convince the patient that they can move back toward wellness. They may not be cured, but we can move them back toward wellness. We can improve their quality of life. We can improve their longevity, and we have done exactly that. A bigger toolbox. I use this all the time with my patients, and this may help you in your practice. I'm not out of the box. A lot of times as integrative physicians, we're looked at as being out in left field somewhere or way out in the stratosphere with the medicine we practice. That's not true. We just have a bigger box than others, and I just have a bigger toolbox. And I say, I've got everything that allopathic medicine has trained me to do. I just have some other tools that I've learned about that are evidence-based and that are working. And they've worked for others, and hopefully it'll work for you. So when the patients leave our office, we give them realistic hope. There would be nothing worse in medicine than if we took a patient that did not have realistic hope and tried to give them hope. But I think we can give them realistic hope. Stay ahead of the boat. I like that one. I use that also because I'm a sailor. I've chartered, and when you have a 50-foot sailboat that weighs several tons and a small diesel engine, you just don't steer it into the dock. You have to look, even with the sail down, you have to look at the wind, you have to look at the current, and you have to stay ahead of the boat. And when I went to sailing school, that's exactly what they taught me to do. And really, preventative medicine and what we're doing is, in my opinion, just staying ahead of the boat and predicting things and preventing things before they happen by keeping our eyes wide open and looking at research. Well, what's that? Okay. This the next two slides will demonstrate, in my opinion, that there's sometimes very little difference between Western allopathic medicine and integrative medicine. And here is Herman. You should see the pills I have to take. Well, look at his jug of water. Now, how many of you have had people come in, they're taking the polypharmacy, they're taking a ton of medication, and you have to clean that up. The next slide. I'm sorry, Mr. Roberts, but the shape you're in, this was the smallest vitamin I could find that could possibly help you. Sometimes we see patients come in, I know I do, they'll have 2 sacks full of nutraceuticals of some kind, and we have to help them sort through those. So there is excess, I guess, on both sides of the coin. However, there is a lot of similarity also, and there's no reason why we can't bridge that gap. Now, into the talk about the Palladium lipoic complex so we can stay on time. The Palladium lipoic complex has been around since the early 1990s, so this is not totally new. But it has, the interest in this has been refurbished recently, and that there are 2 ongoing investigational new drug studies by the FDA into this complex to be used as an adjunct to cancer chemotherapy. My opinion is that once this is completed, and I'll show you some of the statistics on that later, once this is completed, that this compound that we're